Thank you very much for having me. I was invited to give a talk about response-driven treatment in multiple myeloma. So this is really modern thinking. So up to this point, the way patients with myeloma have been treated is that they have been given the same therapy. So what I did was that I went back to the literature and I took out some of the newest studies, and I took one newly diagnosed and one relapse refractory study. These are randomized phase 3 trials. They were both published in the New England Journal of Medicine. So starting off with the newly diagnosed study, I looked at the study where patients were treated with a more intense regimen. They got 3-drug combination with transplantation followed by more 3-drug combination, compared to patients that were just treated with combination therapy with 3 drugs and they were not transplanted. Both arms were subsequently treated with maintenance for a year with lenalidomide. So the overall study result is that the patients treated with transplant, there were more patients that had freedom from disease for a longer period of time. So PFS was better in that group. But what I showed was that if you look a little bit deeper, if you look in each of the 2 arms, you will see that there are patients who actually reach MRD negativity. And if you look a little bit closer to those patients, if you're MRD negative, you have very similar progression-free survival pattern in both of the 2 arms. Then I moved on and I looked into another New England Journal study. This is the study that compared daratumumab, Revlimid, dexamethasone with Revlimid, dexamethasone. This is for patients with 1 or more prior relapses. Very similarly, you see that there are patients on the 3-drug combination overall having longer progression-free survival. But if you dissect the data, there are patients that reach MRD negativity in both arms. Again, when you look and see if you are MRD negative, they have very similar progression-free survival. So what I concluded my presentation with was that MRD is more important than the treatment modality.